The sciatic nerve is the largest nerve in the human body. It's formed from your L4 through S3 nerve roots in the lower back, and it travels all the way down your hamstrings, calves, and into your feet. If the sciatic nerve gets compressed or irritated, it can cause pain, numbness, or tingling down your lower back, buttocks, or legs. The most important thing to understand is that sciatica isn't a diagnosis. It's a symptom of a deeper problem. There are three main types of sciatica. First, discogenic sciatica. It starts when a herniated or bulging disc compresses your sciatic nerve roots in the lower back, causing pain shooting down your sciatic nerve. Second, there's pseudo sciatica, where a tighter inflamed muscle might be irritating your sciatic nerve roots, causing a more dull pain sensation down your leg. Third, there's neuropathic sciatica. It's caused when a sudden increase in your activity turns your sciatic nerve hypersensitive. There's nothing compressing it, it's just very sensitive and irritated, kind of like a migraine. Different types of sciatica require a different rehab approach. Hi, my name is John Bishop. I'm the founder of Recover Pain, and we've helped over 3,500 people get sciatica free using a specific 3-step framework. I hope some of you find it useful. Here's what most people get wrong. The area of pain is almost never where the actual problem is. Even if your pain is running down your hamstring, your calves, and into your feet, the nerve compression is usually upstream, causing referred pain down your nerve. Trying to fix sciatica by stretching your hamstring or massaging your calf is kind of like trying to drink poisoned water by filtering it instead of addressing the chemical leak upstream. You're focusing on the symptom, not the problem. So how do you determine what's compressing your sciatic nerve? Is it a herniated disc? Is it a tight muscle? Could it be both? Each nerve root controls a specific portion of your leg. So based on where your pain travels, we can map out exactly which nerve root is compressed. There are three main sciatica patterns. If your pain travels from your lower back down the back of your hamstring and into the side of your calf or foot, that means your sciatic nerve is compressed at the S1 nerve root. If your pain runs from your lower back down the side of your hamstring and into your shin, sometimes towards the top of your foot, it's compressed at your L5 nerve root. And if your pain starts in the lower back and travels down the front of your quad towards the inside of your shin, it's compressed at the L4 nerve root. Your pain doesn't have to travel throughout the whole pathway. If it stops in your glute or knee, that just means the nerve isn't sensitive enough for the pain to travel all the way through. It still points to the same nerve root. And often two roots are compressed at once, which is why some people feel pain in multiple zones. Once we know which nerve root is compressed, we can also find what's compressing it based on how your pain behaves. If your pain is very sharp, worsens with bending forward, sneezing, coughing, and accurately follows one of the nerve paths, that means you have a bulging or herniated disc compressing one of your sciatic nerve roots. If the pain is duller, more constant, and worsens during or after activity, and isn't accurately following one of the pain patterns, it's more likely a tighter inflamed muscle irritating your sciatic nerve roots. And here's why getting an X-ray or an MRI isn't enough. For chronic sciatica, research shows MRIs are wildly unreliable. A quick story. One of the pain specialists in our team, Sebastian, used to teach pain science at university. One day he took his students to the hospital to teach them how to read MRI results. They pulled up an MRI of an elderly woman scheduled for a checkup that morning. The scan was rough. She had aggressive scoliosis, multiple herniated discs, degeneration, spinal stenosis. The students were expecting her to come in a wheelchair. A couple minutes later, in walks this happy 80-year-old woman, smiling, saying hi to everyone. She walks up to the stationary bike and starts pedaling. One of the students walks up to her and asks, "Ma'am, like, are you okay? Like, are you sure you should be doing this? Are you not in any pain?" And she's like, "Pain? I don't really have any pain. Maybe I'll get some knee pain if I garden a lot, but then I just hop on the bike for 15 minutes and I'm fine." No back pain at all. So despite severe degenerative changes, she had no pain. And she's not an outlier. In 2015, researchers ran one of the largest spinal MRI studies ever done on over 3,000 people with zero back pain. In the 30-year-old group who took MRIs, 50% had spinal degeneration, 40% had disc bulges with zero back pain. In the 40-year-old group, 70% had degeneration, 50% had disc bulges, 30% had full disc herniations with zero back pain. In the 60-year-old group, 90% had disc degeneration and 70% had at least one disc bulge. And these are people with no pain. Pain scientists have started calling these wrinkles on your spine. Almost everybody has them at a certain age. They're not damaged, they're not diseases, they're not reliably linked to pain. Kind of like getting gray hair as you get older. That's when we diagnose chronic sciatica based on symptoms, not scans. The pattern of your pain, where it travels, what makes it better, what makes it worse, tells us a lot more than a static image. Real quick, if this is making sense and you just want to skip ahead and want our help identifying the exact root of your sciatica, complete our sciatica assessment below to apply, and if we see your case is treatable, you'll get a personalized sciatica rehab plan to get pain-free for good. So if scans aren't the answer, and stretching isn't the answer, and injections aren't the answer, what actually works? Here's how to actually address the root cause and recover from sciatica in 3 phases. Phase 1 is fixing the root cause. Based on previous tests, you'll be able to tell the root of your pain is either a herniated disc or a tighter inflamed muscle. Based on what category you're in, phase 1 will look different for you. If you have a herniated disc, meaning your pain follows one of the nerve patterns, your pain is sharp when bending forward, sneezing, coughing, we use the centralization protocol to reduce your disc's pressure off the nerve roots. We start with the reverse lumbar extension and to reduce your disc's pressure off the sciatic nerve roots. You start by standing 2 feet in front of a wall, leaning minute with your elbows. From here, we thrust your spine into extension, contract your glutes, and reverse back into flexion. This will help reduce your disc pressure off the nerve and help your symptoms centralize. Next is the wall-assisted flexion. You start in the wall-sit position with your legs spread apart. Then you start curling your spine from the top down like a tube with toothpaste. Go as far as you feel comfortable. Perform 8 reps, aiming to sink deeper with each rep. And last is the leaning lateral decompression. Start by standing next to the wall with the painful leg inside. Then dip your hip towards the wall to help open up the side of your discs and release pressure off your sciatic nerve roots. These movements help push your spine through spinal flexion, extension, and lateral flexion to help your symptoms centralize. However, if your pain is caused by a tight muscle, and so that it's more dull, worsens during or after activity, and doesn't accurately follow one of the pain pathways, we need to work on strengthening the compressed area to rebuild stability and reduce the need for spasms. Start by standing on a non-painful leg and lean forward by extending your painful leg back. Then externally rotate your hips to contract your glutes and lower back down. Perform 8 reps, aiming to contract the glutes with each rep. Then line a prone position and start raising your legs up one at a time, focusing on contracting your spinal erectors. Perform 6 slow reps on each side, focusing on strengthening your lower back. These will help strengthen your spinal erectors and glutes to reduce their tightness and inflammation around the sciatic nerve roots. Phase 2 of sciatica rehab is pain reprocessing. Once the nerve has been compressed for weeks, months, or years, removing the physical compression isn't enough because it often gets hypersensitive. Pain reprocessing is necessary to retrain that nerve. The movements that were once sensitive are now safe. We start with the most painful movement. Pick the most uncomfortable variation and start with the easiest progression. 3 sets of 10 reps 3 times a day, working your way from easiest to hardest. This will only work after completing phase 1 and help you desensitize your nerve to return to movement. In phase 3 is bulletproofing. This is the phase most people skip. They start feeling better, stop the protocol, and 6 months later, the pain comes back. Bulletproofing is what happens after you're pain-free. We push past that point and build resilience in the tissues surrounding that area. So the next time you bend forward to pick up a bag, sleep at a weird angle, or have a stressful week, your back is robust enough to handle it without flaring up. We want to bulletproof your back in all 3 planes: flexion, extension, and lateral flexion. There are 3 progressions for each. For flexion, you start with seated good mornings, then standing good mornings, and eventually Romanian deadlifts. For extension, you start with Supermans, then back extension isometrics, and eventually full back extensions. And for lateral flexion, you start with wall bridge raises, then elevated bridge raises, and third, floor bridge raises. Perform 3 sets of 10 reps for each of the plans once a day, and continue on to harder progressions as they get more comfortable. So these are the 3 phases that can help you address the root cause, desensitize your nerve, and stay back pain and sciatica free. Again, if you want our help identifying the exact root of your sciatica, complete our sciatica assessment for a personalized sciatica rehab program to get pain free for good. I'll leave you with this. Taking the short-term fix option is hard because you get relief now, but the pain keeps coming back. Playing the long game and focusing on the root cause instead is also hard because it takes time to get relief. Both are hard, but only one leaves you pain-free long-term. Pick your heart. Happy recovery.